Good morning, and thank you for joining us for our inaugural Building Healthy and Thriving Communities Conference here in Florida. This is the first conference of its kind in the Southeast region, and we're very excited to be hosting the meeting here in sunny Miami. You know, as I was thinking about this particular meeting and comments, it instantly drew me to the fact that things are changing so dramatically around us in our environment, both in the context of the world, what's happening for us nationally around issues of race and gender, issues around what our government is becoming and how it's starting to change and what it will look like. But it raises a lot of questions for us of how do we continue this work through all of this challenge and chaos. You know, I had a pastor tell me one time, he said, you know, Roderick, always remember when one door closes, another door opens. But keep in mind, it's a journey to get from one door to the next. And that's partially why we're asking you all here today, is to join us in that journey as we think about new ways of doing this work together, innovative ways of engaging others to be part of this, and utilizing and leveraging all our resources that we can bring to bear around improving the lives of individuals, families, communities in Florida. So I'm honored here to welcome you on behalf of my co-hosts, the Atlanta Federal Reserve, Catalyst Miami, the South Florida Community Development Coalition, Neighborhood Housing Services of South Florida, the Health Foundation of South Florida, and the Florida Institute for Health Innovation. My name is Roderick King, and I am the CEO of the Florida Institute for Health Innovation. Before I begin, I'd like to just take a moment to thank our sponsors today, who, without their generous support, this conference would not have been possible. We'd like to thank J.P. Morgan Chase, Allegheny Franciscan Ministries, Health Foundation of South Florida, the Federal Reserve Bank of Atlanta, Florida Blue, and TD Bank. And also to the list that's not listed here is Dr. Luther Brewster, who was generous enough to support the funding to help us record this so that those that aren't here today can be able to watch it on the web. So please join me in thanking our sponsors for making today a possibility. So you see, these meetings are not new for the Fed Reserve. Thanks to the insightful and visionary leaders within the Fed Reserve, folks like Todd Green, David Erickson, and others, these meetings were first started by the Feds over a decade ago. Since that time, 9 of the 11 Fed Reserve offices or regions have hosted this type of meeting, and this will be the 10th to embrace this engagement. So you may ask yourselves, why do we even need to have these types of meetings anyway? We're all doing good work to improve the well-being of individuals and communities that we serve. Well, this is true. However, we can do it much better if we do it together. So without risking stepping on the toes of my two fantastic start-off speakers, I'd like to mention that just to give you a ballpark, that healthcare, we spend close to about $3.2 trillion in health and health services. The U.S. Department of Housing and Urban Development spends up to $13.2 billion just in community development block grants. Public health spending has been close to $10 to $15 billion over the years. And surprisingly, there's very little communication or discussion between them. Yet they are all serving the same people and populations. How can that be? You see, my healthcare and public health career took me in a new direction in the early 2000s to figure out how do you get leaders from multiple sectors to take aligned action for measurable results, particularly for some of the intractable social issues that we may be facing, issues like early education for our children, eliminating infant mortality, reducing poverty, tobacco cessation. And having done this work in Baltimore with the support of Annie E. Casey years ago, and seeing infant mortality decrease in Baltimore by 29% and the reduction of health disparities by 40%, I realized the power of leaders coming together and taking aligned action. So coming to Florida, these same challenges existed for me. Many of you may have heard that your zip code can better predict your life expectancy than your genetic code. For example, the life expectancy in Liberty City is 16 years less than in Key Biscayne, and 14 years less than Miami Beach. Poor housing and limited access to good housing is driving up our asthma rates and impacting our children's achievement in school, and we continue to see growing poverty rates for our families and children. So we engaged a group of leaders, all of you here today, and our planning committee, to embark upon a journey that brings together our individual resources, our commitments to tackle this issue, and our passion to build healthy and thriving communities. So I'd like to start off today to say thank you. Thank you for your willingness to learn about this journey, and thank you for joining this journey with us. Because whether you're from the business community, financial services sector, community development, healthcare, or public health, we need all of your passion and collective wisdom to make Miami the all-star city it can be. So just for me to touch on very quickly some housekeeping issues. We don't have, in terms of parking stickers. If you just let the valet know that you're here at the conference, they will give you the discounted rate. For the Q&A session, on your tables there should be index cards, so we're asking folks to write down their questions on the card, and there'll be someone coming around to gather those cards to pass them to the facilitator. When you came in, to the right, you may have noticed there was a big table with a lot of different documents and papers. That's our resource table that contains many of the materials that you'll hear about today. Feel free to look at those and take some of that material. And all of the speakers' bios are in the program, so you won't hear us doing full introductions because we'll reference the program book for you to get more details. And then lastly, for those of you that are more media savvy, let's see if we can beat what's trending today. So we've got 3 hashtags up, #FedHealth, #ZipMatters, and #HealthyCommunitiesSFL. That's South Florida. Please feel free to take pictures, tweet, text, Facebook, whatever you'd like. We want to try to get the word out that we're having this great event. So without further delay, let me introduce 2 co-hosts and colleagues who would also provide a welcome message. Just very briefly, Todd Green is the Vice President at the Federal Reserve Bank of Atlanta and leads the Community and Economic Development Department of the Federal Reserve, where they oversee research. After Todd, I have the pleasure of bringing up my dear friend and colleague, Dr. Steve Marcus, who's the President and CEO of the Health Foundation of South Florida. So please join me in welcoming Todd Green.
Well, good morning, everyone. Okay, well, I'm from Atlanta now, so we do a little different in the South. Good morning, everyone. Yeah, okay, and thank you. I'm afraid to think about what's trending today. I know each day I wake up and I'm not quite sure if I want to even know, but we will have some very exciting things that will come out of this conference today. I definitely want to just say that we're just so very proud to be a part of this conference. It really is an important conversation, and my remarks today are really going to be about collaboration. And I think that when we think about community development, economic development, and when we think about how our economy progresses, it's really important that we think no one of us can do it alone, right? I mean, we've heard, about other things, but we definitely know that this is a sector that requires collaboration. So my department at the Fed, we study the power and cross-sector collaboration to support inclusive growth and economic mobility. And we're excited to witness that collaboration right here in this room, which is full of experts really transcending a lot of our sectors, including health, finance, economic development, housing, and education. And these sectors don't always come together, so this is really an important opportunity. So I have a couple of hopes from today's conference. Number one, I hope that you come away from this event having met someone new. I know I've already met a few people new, and so I hope that you'll continue to do that. And I hope that you'll be inspired by really the power of cross-sector collaboration to help people to achieve whatever their dream might be. And then finally, I hope that you will deepen your understanding of the power of cross-sector collaboration and to help individuals claim a slice of the pie that they themselves deserve. Now, I'm really especially heartened today about the conversation in South Florida to develop these new partnerships. And as you've already heard, it's really a health issue, but it's also an economic issue. We've heard about the situation about life expectancy. And by the way, I am from, even though I live in Atlanta now, I'm from Liberty City. So I hope that my life expectancy and those, well, okay, all right, well, I had bacon for breakfast this morning, so it may not be what I want it to be, but on a serious note, it really is important that we begin to kind of reverse those negative trends. That really is a very shocking statistic, but it really isn't just, it's not just true of Miami. This is a national trend, and I'm sure that if we look across South Florida, we'll see that it exists across our state as well. Okay, so to help support this area of collaboration, I've mentioned that to you. My colleague, Samira Fazeli. Samira, would you raise your hand or stand up? You'll hear from her later today. But she just really, released a paper today. In fact, if you go to our website, you'll be able to see it. But it really is about this cross-sector collaboration. So once again, I encourage you to take a look at her research. And I want to give just a couple of thanks before I close out here, and one is to David Erickson and the team in San Francisco at the San Francisco Fed. We thank them for their leadership on this topic, even at a point when perhaps it wasn't really popular, when people were saying, well, why is the Fed involved in this work? But really being able to link together this economic discussion and how we think about health, I really applaud him and his leadership for on behalf of the entire system. We've also heard a number of thanks already to our partners, so I'm not going to go into details, but I especially want to thank Steve and Janice for their leadership in thinking about community, adding and learning about community development and putting this all together. I think this has really been a great opportunity for us to drive this conversation forward, and their leadership has been particularly important. And then lastly, I'm of that age. I want us to, at the end of this, I asked Gretchen and others about what are some of the outcomes that we want to have today. At the end of today, what do we want to, what happens? So discussions are nice, but I really hope that we end by thinking about what are we going to do and seeing some action, because the last thing I want is for us to be having this kind of conversation again 10 years from now. We know this is an iterative conversation. It's the beginning. What a wonderful start that we have today. But as you go through the day, I really hope to encourage you to think about that. So with that, I'd like for Steve to come forward. Thank you.
Good morning. It's my pleasure to welcome you to this conference and to thank Dr. King, an outstanding member of our board, for inviting Health Foundation of South Florida as a partner to sponsor and organize this convening. Today's agenda is well aligned with the Foundation's newest initiative, Community Building and Economic Prosperity, which is our effort to integrate multi-sector partners, engaging them to improve social and economic determinants of health. To launch this initiative, we've started to build a South Florida anchor institution community to explore opportunities for hospitals, colleges, and universities to utilize their procurement systems, employment pipelines, community investments, community benefit activities, to improve greater inclusion for our region's workforce and small businesses while adhering to their own organizational goals and priorities. Our foundation has its roots of accomplishments in South Florida's healthcare system to treat patients. Now our organization has a different focus. It's been said, on the average, the amount of time Americans spend visiting their healthcare provider may be less than a half a day a year. So I ask you today, what are we doing the other 364 days of the year? It is time to focus on our environment by creating a community which promotes healthy behaviors, disease prevention, and economic development through public policy and system change. Shouldn't we be building healthy and thriving communities? Get ready today to listen and interact with this message from today's national, state, and South Florida's finest speakers to advance the cause of changing our community to be a better place to where we live, work, and play. On behalf of the Health Foundation of South Florida, we thank each of our partners for being here, as well as some of our board members who I think are here now, who I hope you meet throughout the day. In addition, I also want to thank Todd and the support of the Federal Reserve and the great efforts of the Florida Institute of Health Innovation under Dr. King's leadership, and that's greatly appreciated. I am also pleased to recognize two members of our senior staff, Dr. Janice Shupp and Sherry Gantman, who have volunteered to give their expertise to help coordinate, do event planning, and programming for this conference. Today, as Roderick framed and stole my line, as I make my final comment, have a great learning journey. I'm going to be on my way in a little while to Princeton, New Jersey, to join my colleagues who are part of Health Equity Award winners in our alumni group. So if I don't see you later on, again, it's a pleasure to meet you all and wish you a great day. Thank you.